Marley Drug.
Hello, welcome to Ask Marley Drug. My name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. So today we're going to talk about commonly asked questions I get for a medication called Lovastatin. Lovastatin is available in two forms, as an immediate release tablet and as an extended release tablet. The immediate release form is also known as Mevacor, and the extended release form is known as Altoprev. Lovastatin is a prescription medication that belongs to a group of medications called statins. Statins help to reduce cholesterol, specifically bad cholesterol or LDL-C. So if you're diagnosed with high cholesterol, your healthcare provider will typically recommend changes to diet and exercise first. If that doesn't work, then statins are your first line of defense. Lovastatin, like other statins, works to reduce cholesterol by lowering the amount of cholesterol your body makes by blocking an enzyme in your liver called HMG-CoA reductase. Lovastatin is considered a low to moderate intensity statin, depending on the dose you take. It's available in 10, 20, 40, and 60 milligram tablets and can be taken in 1 or 2 divided dosages. The highest recommended dose of Lovastatin is 80 milligrams. However, it should only be used after careful consideration of the potential risks and benefits with your doctor. Your medical history, response to therapy, age, and any additional medication you may be taking will all factor into the dose prescribed for you. So if you have high cholesterol, why is it important to take Lovastatin? Well, it's important because over time, bad cholesterol can accumulate on the sides of your blood vessels and decrease blood flow for certain organs like your brain and heart. So, this buildup is commonly referred to as plaques, and when these plaques rupture, this can create a medical emergency known as a heart attack or stroke. By lowering your cholesterol, Lovastatin helps to reduce the buildup of plaques, which then reduces a person's risk of developing a heart attack or stroke. This is particularly important for people who have multiple risk factors for heart disease. So when is the best time to take Lovastatin? Lovastatin can be prescribed to be taken once daily or twice daily with a meal. Lovastatin is usually prescribed to be taken in the evening. It has been shown that Lovastatin is more effective when taken in the evening rather than in the morning. It's also recommended that you try to take the medication at the same time each day, as it's much easier to remember to take it that way. Keep in mind that there are other statins, such as zypitamag, that can be taken at any time of the day because it has a longer half-life, which essentially means it lasts longer in your body. What if you miss a dose? If you do forget to take a dose, take it as soon as you remember, unless it's almost time for your next dose. In this case, skip the forgotten dose and take the next one at the usual time. Do not take 2 doses together to make up for a missed dose. So what are the side effects of Lovastatin? Some common side effects include headache, lack of energy, dizziness, cold-like symptoms, including a sore throat or stuffy nose and sneezing, trouble sleeping or insomnia, nausea, heartburn, stomach pain, indigestion, constipation, and muscle pain or soreness, including joint pain. So, if you're experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. Does Lovastatin interact with other medications? Yes, it can. Always talk with your healthcare provider and tell them about all medications, supplements, or vitamins you may be taking. Importantly, Lovastatin is processed by our body through an enzyme called CYP3A4. This enzyme is part of an enzyme family called cytochrome P450, and this family of enzymes is responsible for processing nearly 70 to 80% of all drugs on the market. So as a result, there are risks of taking Lovastatin with other medications, including a significant increase in your chance of developing serious muscle issues. If you are taking multiple medications and are worried about potential drug interactions, there are other statin options that bypass this pathway, such as pravastatin, fluvastatin, and zypitamag or pitavastatin. Some medications that Lovastatin can interact with include itraconazole, ketoconazole, clarithromycin, gemfibrozole, and niacin. What should I avoid while taking Lovastatin? Grapefruit and grapefruit juice should not be used with this medication since there may be an interaction that results in undesirable side effects. Avoid consuming food that's rich in cholesterol or fat. If you don't adhere to a diet that lowers cholesterol, Lovastatin won't be as successful lowering your cholesterol. Lastly, avoid taking lovastatin with alcohol as it may increase your risk of liver damage and your triglyceride levels may rise as a result. So, like all medications, you should speak to your pharmacist or your healthcare provider about any questions you may have. There's lots of information on high blood pressure, cholesterol, and other cardiovascular treatments on our website. Check out our blogs in the links below. Bye for now!